Jody's going to do a presentation, and I can't read it.
It's in English.
In English.
You got it.
Is it in New Yorker? Oh, here we go. We're going to bring up hands-off Social Security presentation. But before Jody comes up, stand up. We absorbed a lot of information. Stand up, stretch. Contemplate what is the 10th number in pi.
The first number, 3.14.
No, and if you can't do that far, just remember it's 22 over 7.
No.
Okay, now Jody, come up here.
Hello again. So how many of you have kids or grandkids? A lot of you. So I want to start just by saying that what Eric talked about in terms of this program being one that you built, was Social Security was voted into being in 1935 and Medicare and Medicaid in 1965. We have all been paying into the system. And those of you who are receiving benefits now are getting them in part because the people who are currently working, like Pi and myself and all of your wonderful staff at SDA, are paying in to the system so that those of you who are currently getting benefits can keep getting them. And our goal is to have jobs and benefits paid into by our kids and our grandkids so that eventually we can receive the benefit like all of you are. It is a universal system that we all depend on. It's one for all and all for one, and in part that's why it has worked so well and why it has such huge public support regardless of political persuasion. And I think every time I hear Eric speak and I think about this, it just makes my blood boil, because how dare they? How dare they even talk about cutting these programs? These are our programs. We paid for them. It's our bank account. And this is what we all depend on. How many of you are from a union household? I'm going to talk a little bit about Medicare and Medicaid because you heard quite a bit about Social Security. The one thing I want you to remember as we move forward today is that Social Security has contributed not one penny to the deficit. Not one. So to even have it be part of the same sentence as a deficit reduction plan is a bunch of phooey. That's a very nice way to say what I was going to say. It's a bunch of phooey. For Medicare and Medicaid, the proposals on the table, which include raising the beneficiary age for Medicare from 65 to 67, is not only another bunch of BS. It's a huge benefit cut. It means that we are potentially unable to continue to get health care coverage until 2 years later when we're certainly older, but also possibly sicker. But for those of you who are fortunate enough to either be in a union or be in a situation where your employer pays for care and where your employer has negotiated for retirement benefits that supplement your Social Security, because as you know, Social Security doesn't pay for everything. So you need supplemental benefits, either through Medicare if you're income eligible, or through private insurance. If your employer or your union has budgeted based on assuming you're going to get Medicare at 65, and then you can't get it until you're 67 because of this phooey that's going on in Washington, that is going to drain your union trust funds, it's going to drain your employer's benefit programs, and could potentially be disastrous, not just for you and for future beneficiaries, but for all of the unions and the programs that have been built around this basic benefit. And if we don't start thinking about it, we could be in even a deeper heap of trouble than we're in right now. The thing about Medicare that is really important to remember, and Eric mentioned it, is that Medicare is the health program that serves the hardest to serve population. It serves people who are older, who have more chronic illnesses, who use the healthcare system regularly in order to maintain their health, as well as people with disabilities who similarly use the system more often to maintain their health. Insurance companies, the private market, depends on having 80% of their customers not using the benefit. They pay into it, but they don't use it. Only 20% are using it at any given time. That's where all the money comes in, and they're just collecting, and hoping that at any given time only 20% are using it. In Medicare, the opposite is true. At any given time, close to 80% of the beneficiaries are using the system, and yet it continues to be able to provide coverage to everybody in the system and operates at under a 3% overhead. And this is the hardest to serve, most costly population. So the answer to Medicare is not raising the retirement age so that even older, sicker, unhealthy people are in it. The answer is to put the younger people in it. It should be a system where everybody's in it. Why are we paying insurance companies 20-30% overhead so that they can line the pockets of their stockholders and their CEOs instead of putting it into health care? That's right. So I think that we really need to be offering solutions that make sense.